On behalf of Riverside Township, the Board of Trustees, the Riverside Township Mental Health Board, I'm pleased to welcome you to another presentation on mental health. These programs promote awareness, provide resources, and offer tips on dealing with emotional impact of these times on our lives and those of our loved ones. As a little background, unlike state, county, or village government, townships focus on social services such as the food pantry, the nurse's closet, general assistance, emergency assistance, senior programs, and of course, the assessor's office that helps homeowners get all their exemptions and appeals to their taxes done. We support community service and volunteer organizations who often can do the work more efficiently than we could. With the approval of the Township trustees, I appoint members to the Mental Health Board, and that board works through professional organizations to fulfill the needs of the community regarding mental health, including substance abuse, developmental disabilities, cognitive impairment, and so much more. Most recently, the Mental Health Board has provided crisis intervention training to the area's first responders. They have developed and fund the Community Resource Center, which is a team of professional social workers who help residents navigate the road to supportive services. Their office is in the town hall next to the township office. They have helped people apply for state benefits, find a job, line up senior services, and so much more. We hope the following presentation will be enlightening to you and wish you all good health and good mental health.
Hi, everybody. My name is Trina Bockus. I am a family support specialist with NAMI Metro Suburban, and I am here with Terry, and we are going to discuss what it's like to be a caregiver of an adult with a mental health condition. Terry, what is living with someone who has a mental health condition like on a good day?
On a good day, my family member with a mental health condition is my husband of 20 years. And he became ill, very ill, in 2013. And on a good day, today, our life is not that different from how it was prior to his illness in 2013. We talk, we laugh, we listen to the radio together, we read together, we talk about our books, we make plans to see friends and family, we talk about our kids. And those are good days. We feel very close. In fact, I would say that because of Family to Family, which is the 8-week course NAMI teaches, it's free, it takes 8 weeks. You meet once a week for 2 or 3 hours with other family members and some NAMI coordinators, and you get educated on living with a loved one. That course was really educative for me in terms of mental illness, and also gave me techniques for relating to my husband in his psychological state. And in some ways, that course made my marriage better. I am more compassionate, a better listener to Bob, and he's always been a really compassionate, good listener to me. But the strain his illness put on our marriage definitely imperiled our marriage and stressed it. But Family to Family has given me techniques for relating to him better. So today, on a good day, our marriage is even better than it was before he was sick.
And what is it like on a challenging day?
A challenging day is a day when my husband is still feeling symptoms. They flare up, even though he has been in therapy and has a good medication regime. But on a bad day for my husband, he feels tremendous anxiety, and we are not on the same page. So on a bad day, he and I are drifting into different worlds. His world is miserable, full of fear, full of worry. And if I'm am having a normal day, I am angry. Like, why are you acting like this? Why are you talking like this? Why are you raining on my parade? And there's a lot of stress there. So on a bad day, we are on different pages. We are not emotionally connected. We're in different worlds. And the only thing that gets us out of a bad day is if I stop, because he can't, he's feeling symptomatic, is if I stop and relate to him psychologically. And instead of saying, all your fears are irrational, I'm not going to listen, this is annoying, it's irritating, I'm going to shut you out or even shut you down. If instead of that, I sit with him and go, let's talk. What are you worried about? I can help you with that. And basically relate to him psychologically, even though I don't agree with his perception of reality. I can calm him down, and he can be calmed down. So a bad day is when we're on different pages, and it'll stay bad. It'll get worse unless you stop in your tracks and say, okay, honey, you're worried. Let's talk.
That's great advice and really helpful for all of us, I think. What resources have been most helpful to you over these past 9 years?
Absolutely. The lifeline I was thrown in 2013 was being told by a neighbor whose daughter has mental illness and who knew what I was going through, that my husband had changed and, had stopped going to work and had been hospitalized and was having, suicidal ideation. She said, you should check out Family to Family. That's what we did when our daughter got ill. And so I made a note of it. And then I even went online and signed up. And then the day came for the first meeting. I should mention Family to Family. Did I already describe it? Okay.
Yeah.
That Family to Family was meeting that night. And I was sitting in the car and it was pouring rain, like the Des Plaines River was overflowing. Our basement had 2 inches of rain. And I was feeling, I am not handling my life and I hate everything. And I texted and said, I'm not coming to tonight's meeting. I'm in too much crisis. And the volunteer coordinator for Family to Family called me, picked up, or my phone rang minutes after I'd sent the message. And she said, what's going on? And I said, I can't come. My husband's sick. It's raining. I'm cracking up. I got to get my kid at daycare. And she said, Teresa, I really think you should come to this meeting. So I did. And that changed everything, Trina. The Family to Family gave order to what I was going through. It explained what was going on in my husband's brain and what was going on with him psychologically, what the resources were, and how I could handle it, how I could take care of the rest of my family. It gave me a roadmap. And suddenly I was not in the wilderness. I did have a roadmap and I used it. And I loved the course so much that I became a teacher of the course, which allows me to meet other people in the community who tend to be kind of big-hearted, good people. Coincidentally, I've just loved every student I've ever met in Family to Family. And it gives me a refresher. Every time I teach it, I get refreshed on the techniques. So that's been a number one resource. I also had a loving mom and dad, my sisters and brothers, my husband's sisters. Many people come out of the woodwork when you're frank about what's going on. And so I learned from Family to Family to be honest and candid, not cover up, which was my first instinct, because I felt I don't want to hurt my husband's reputation, have people think he's got mental illness. And then I realized, God, I'm a victim of the stigmatization. I'm perpetuating the stigmatization. So now I talk about it openly, find out, boy, it's everywhere. And anyway, so NAMI and friends and family I've met through and because of NAMI have been a big help.
Thank you. And thank you so much for sharing your story here today with us.
You're welcome.
Hello, my name is Chiara de Meglio. I'm a board certified behavior analysis and I work with Lisa, who's a caregiver. And Lisa, how long have you been caregiving?
I've been caregiving for 28 years in this home, and I have 3 men who have developmental disabilities who live with me.
Cool. And how has caregiving during the pandemic impacting you as a caregiver?
I think just the higher level of stress, worrying about the guys getting sick, kind of the isolation. We've pretty much been isolated for the last 2 years. Just little behavior issues that come up with the guys not being able to see family,
Right.
not being able to access the community and go out like they are used to doing. Just kind of the, just not seeing family, and that goes for myself as well.
Yes.
I haven't really been able to spend as much time with my family and friends as I'd like, just for fear of bringing COVID home.
What piece of advice would you give another caregiver that is feeling isolated, alone, or not knowing what to do?
A lot of phone calls. A lot of phone calls. I've done a lot of FaceTimes, house party, a lot of a lot of Zoom meetings with family and friends. Nice. Hopefully the weather's getting nicer. We
Right.
could start doing a little more, being around more people, like out in outside settings and stuff. And yeah.
And what resources have you used for self-care?
I do a lot of car rides when I have respite. I have 2 respite workers. I get 15 hours a week of respite.
Okay. And your little fur babies.
Yeah, and I have 2 dogs that have been a godsend during this because they've kept everybody busy. And we go for car rides. We, go get my nails done or something.
Yeah.
Just to get out of the house, get away, get a
For
clear break. Just some kind of me time, and
For sure.
yeah.
And what are some of the struggles you face with caregiving?
I mean, obviously every day is different here.
Yeah.
We do have, all 3 of the guys here do have some level of behavior issues, as well as one of the men here has some significant medical issues. And that's pretty much, been a lot of the just stress,
Making sure that they're safe.
Right.
And what are some of the benefits to being a caregiver?
Love the guys.
Yep.
Love the guys. We have a good time. I feel like I'm doing something worthwhile.
Yeah.
I love my job. Love what I do. So, yeah.
Nice. Well, thank you for taking the time to answer these questions.
Thank you.
Greetings. I'm Dr. Joe Troiani, an advisor to the Riverside Township Mental Health Board. I myself am a resident of Riverside, the village of Riverside, and also a veteran. That is, I'm a retired member of the United States military. My interest and work in mental health spans over decades, and one of the exciting things that I have seen evolve over the last couple of years is the evolution of 708 boards, and in particular, the Riverside Township Mental Health Board. The Riverside Township Mental Health Board consists of members of the community. We meet on the 3rd Wednesday of the month here at the Riverside Township Hall, with the exceptions of July, August, and December. And a very important part of what we do is to support those agencies that are serving those here in Riverside Township, consisting of the Village of Riverside, also North Riverside, as well as Brookfield. Today is the 4th in a series of special programs that we've instituted, with the last 3 especially focusing in on the whole issue of the long-term psychological effects of the COVID-19 pandemic. In previous episodes of this program, You've learned about the impact that COVID-19 is having psychologically on adults, on children, as well as those older adults. We've also had the opportunity to take a look at the impact that this is having on those living with special needs, as well as those who are living with mental illness and or substance abuse. We're going to be focusing in on the caregivers. As we talk about the impact, I was asked a question, are people experiencing post-traumatic stress disorder? And my response is, we are not post-pandemic in order to have PTSD. The psychological consequences will be long-lasting, ranging from the impact on children. You cannot pick up a newspaper or a magazine without seeing an article relating to what the impact has been on children. And taking a look at the hard data, we're seeing in 2020, 2021, sharp increases in suicide, sharp increases in terms of substance abuse. Definitely the substance abuse, opium overdeaths are now at record levels. So we are seeing the effects that COVID-19 has had on a mental health system that has been struggling for the last few years. That is, it tended to be underfunded, and not enough resources were put into mental health services. The good news is that is pretty much changing because, again, of the COVID-19 pandemic. So welcome to today's program. You'll be hearing from those who are serving our community, all of them experts in their particular specialty area, and we're going to take a look and examine the impact that this is having on caregivers within the various communities. So thank you for watching and hope you enjoyed the program. Welcome back. Again, this is Dr. Joe Troiani, and in this segment of today's program, we're going to be examining caregiving for adults in the disability community. And to learn more about what is available, we have representatives from 3 organizations, Helping Hand, UCP Seguin, and WSSRA. And what I'd like to do is turn it over to our panel for them to introduce themselves, the agency they represent, and what they do for the agency. So we'll start on my far right.
Hello, I'm Kim Peyton-Reyes, and I'm a social worker at Helping Hand.
Hi, my name is Chiara Meglio, and I'm a board-certified behavior analysis at UCP Seguin.
Hello, my name is Carlos Marroquin, and I'm the program manager at WSSRA.
Good. We have a series of questions, and I'm going to direct it to the agencies. So Helping Hand, can you briefly describe the supports and services your agency offers caregivers?
Helping Hand has a wide range of services for adults and children with intellectual and developmental disabilities, but today I'm going to talk about adult services. We have a wide range of services to assist you in supporting your loved one. Employment services, outpatient occupational therapy and speech therapy, 12 residential homes, including one that specializes in aging services, community day services with behavior services, as well as a grace room for our aging population. We also offer outpatient and community day services with mental health services that are online services for our individuals and our families.
Good. The same question to UCP Seguin. What are the types of supports and services that UCP Seguin offers caregivers?
For caregivers, we provide respite staff, behavior support services, as well as a 24/7 crisis phone line for any behavior de-escalation. We also provide safety care training and individualized behavior plan training. Our goal is to train caregivers on how to prevent maladaptive behaviors and how to react appropriately when maladaptive behaviors occur, and most importantly, teaching participants more socially appropriate ways to communicate their wants and needs.
Yeah. The same question to WSSRA. Can you talk a little bit about the support and services that your agency offers?
Yeah, WSSRA works in partnership with 12 Park District and Village Recreation Departments. We offer recreation programs for adults and children with special needs of any age and any ability level. Some of the programs that we offer are Special Olympics, fitness programs, swimming, music therapy, cooking, virtual programs, and many more. WSRA also offers door-to-door transportation, which allows our families to get to our program locations a lot easier. You guys can visit our website for the most current program brochure.
Good, thank you. You know, it's almost 2 years ago, probably 2 years ago next week, that the pandemic hit us. And of course, what did it change? It changed everything. And hopefully, we're seeing the light at the end of the tunnel regarding the pandemic. But one of the things that we know that has had a dramatic effect on the agencies, and the agencies have done a yeoman job in responding to the pandemic and the increased requests for services. But what I'd like to do is examine how this has impacted each agency. So, Helping Hand, can you describe in what ways Helping Hand has grown as a result of the pandemic? How has it changed things? How has it made things different? And what's your experience? What has that been?
I believe the pandemic has really made our agency more creative in our programming. We have added very creative lineup of online services for our day program and offer online options for occupational therapy and speech therapy, as well as mental health services for individuals and families with online platforms and individual care. We have started online parent trainings to make sure we are meeting the needs of our caregivers that are too busy to meet in person. We have also begun trainings for family members on how to better support their loved ones through the COVID-19 pandemic when they have increased depression, anxiety, and stress.
Good. Same question for UCP Seguin. How has this pandemic caused UCP to grow, change?
Throughout the pandemic, telehealth has been very convenient for caregivers. We took extra precautions to reduce the number of people coming in and out of their homes. Our agency has learned to adapt to using telehealth in order to continue to provide services support and to maintain communication between participants and their families. Our agency's goal is to provide participants a life without limits. We've provided caregivers with both visual and written instructions on how to appropriately wash your hands, wear a face mask, and how to create and or join Zoom meetings with an iPad, and also how to use popular apps such as YouTube. Having the resources, technology, and support systems available has helped us to continue to stay safe, connected, and grow.
Good. Same question for WSSRA. How has the pandemic caused growth in your agency and changes?
Yeah, the pandemic has really allowed our staff to develop new ways to keep our participants active and engaged. For the past couple years, our staff have put together videos, resource links, provided one-on-one chats, delivered supply kits to families so that they're able to participate in activities at home. We've offered Chromebook laptop rentals and hotspot rentals for those families in need, and countless of other virtual programs. We understand that most of our participants are still not comfortable coming back to our in-person programming, so we will continue to offer those virtual programs as long as there's a need.
One of the advantages of being part of the Riverside Township Mental Health Board is hearing the reports on a monthly basis from the agencies. And one of the things I found exciting is to see how you were assessing what was going on, adapting, and overcoming a lot of the challenges that you guys were meeting as agencies. And I think one of the wonderful things that came out of this was the use of telebehavioral health, which is now permanent. It's by law, it is now permanent. And again, what I've been hearing from the agencies is another tool that you have in your clinical toolkit. And it helps with barriers of transportation, it helps with barriers of childcare, as well as maybe specific mental challenges, from agoraphobia to anxiety, that the person is still accessing treatment. But one thing I would have to say, the board is very proud of what we've seen over the past 2 years, and I think it's well worth mentioning. Helping hand. The next question. We have caregivers watching this program. What advice would you give to those caregivers out there?
Sure. Please reach out to other caregivers that are working within your field. Most caregivers want to connect with other people that work in the same population that they do and have the same struggles that they do. Don't be afraid to ask for help. That might mean reaching out to your doctor, friends, family, or agencies like Helping Hand. Organizations like Helping Hand want to help you through your struggles. We want to support you. So please reach out to anybody like Helping Hand or other agencies like ours. Ask questions. The adult world of intellectual and development disability is very confusing and challenging. Please reach out to an agency like Helping Hand if you have questions or need services. Make sure you're taking care of yourself through self-care and relaxation techniques. Anything from taking walks with friends, deep breaths, counting to 10, a long bath, or taking a walk are great ideas. If you absolutely have no time to do these things, do it with the person you're giving care to. They can learn great coping skills and you can relax as well.
Good. Very similar question to UCP Seguin. What advice would you give to those caregivers out there?
Be proactive in advocating for yourself. Please reach out to your behavior analysts, supervisors, case manager for any concerns and needs. We're in this together, and we want to make sure you feel supported as possible. And teamwork makes the dream work.
Good. And finally, WSSRA. What advice would you give to those caregivers out there?
Just taking that time for yourself, especially during these challenging times. So utilizing WSRA's program, whether it be for 1 hour or a few hours, to take that time for yourself to feel rejuvenated. We offer programs almost 7 days a week at any time of the day. So definitely just to take a look, and there may be something for everybody there. And do not hesitate to reach out. Just like the other agencies, we're here to help and hopefully get through this together.
Good. I think the important message that you have is COVID-19 can be managed. Mm-hmm. Rather than it ruling you, you could rule it. Mm-hmm. And the advice and recommendations are very helpful, but the important thing is these are things that need to be practiced. In the remaining minute, is there any final comments from our panel? No. Okay, well, thank you. Again, our representatives from WSSRA, UCP Seguin, and Helping Hand, 3 agencies that serve the Riverside Township community. Thank you. Welcome back. Again, I'm Dr. Joe Troiani. In this segment, we're going to be talking about caring for adults who are living with mental health or cognitive issues. And to join us, we have a couple of organizations that serve the Riverside Township communities: Pillars, National Alliance on Mental Illness, and Aging Care Connection. What I'd like to do is to have our representatives from these agencies introduce themselves, what they do at the agency, and maybe just a couple of words about what your organization does. We'll start out to my right.
Hi, my name is Homolka, and I'm a community support specialist in Pillars Community Health.
Hi, I'm Trina Bockus. I am a family support specialist with NAMI Metro Suburban. I help families who have a loved one with living with a mental health condition.
Hi, my name is Susan Bertuglia. I'm a licensed clinical social worker at Aging Care Connections. I do a couple of different things at Aging Care Connections. I work out of a little office that we have over at a local community hospital, helping put services and supports in place for older adults. And I also help staff the Community Resource Center here in Riverside Town Hall, and we'll be talking a little bit more about the CRC at the end of the program.
Good, good. The first question is really to both Pillars and NAMI. And the question is, what are some of the most common challenges that caregivers experience when caring for an adult with mental illness? What makes it hard for caregivers to talk with others about the mental health issues of that person that they're caring for?
We provide a wide array of medical, dental, and behavioral health services, but one area that might be helpful to the caregivers is our community support programs. These services are provided in a natural setting to help the clients build the skills and engage more in the community. Some examples of these skills that we work with are budgeting, social skills, and anger management. We also help access resources and entitlements like Medicaid and Social Security, which can help alleviate some of the stress for the caregivers. We try to provide a team of support that work with the entire family and other providers to help the client meet their goals. We develop an individual plan based on the specific needs of each client. We focus on the client's strengths and incorporate their interests to get them more involved and feel like they have control over their treatment. It's not about us telling them what to do, but giving them the opportunity to tell us what they want to achieve and how they are capable of achieving these goals. We do a lot of psychoeducation for the caregiver to help them understand mental illness themselves and help with the skills to provide the clients. We help them feel like they're not alone in supporting the client and encourage them to focus on the small victories.
And one of the things that I think is hardest for caregivers is a sense of isolation, not really knowing who or where to turn to. And the idea that they need to balance their needs along with their loved ones' needs, whether that is in a short-term crisis type situation where things happen really fast and you're navigating a lot of systems and programs that you might not fully understand, but also on a longer term, kind of just day-to-day basis, how you manage your needs versus your loved one's needs. And I think it's really hard for people to reach out to friends and neighbors because there is stigma around mental illness. And sometimes caregivers are afraid if they reach out, they are making themselves and their loved one vulnerable to that stigma, to negative comments, to people sometimes not being really helpful. So I think that reducing that stigma helps people to feel more comfortable reaching out, and organizations like NAMI work to do that by connecting people with other caregivers and by reducing stigma overall.
What's very exciting is when the pandemic hit, within a very short period of time, NAMI started putting a lot of their support meetings and group meetings online using Zoom or Skype or some of the other platforms that are available. So there might have been kind of a bump in the offering of these support services, but nevertheless, they're there and they're going strong. And I would assume they're going to be around for a while.
Yes, they are.
A little further information regarding NAMI. What types of resources and services did NAMI provide to individuals struggling with mental illness?
So NAMI Metro Suburban has 3 living rooms, one in LaGrange, one in Broadview, and one in Summit. They provide service on a walk-in basis to anyone over the age of 18. They're open from 1 to 9 every day. Services are always free. Anyone can walk in, get an assessment from a mental health professional, from a clinician, and then speak with a recovery support specialist who is a peer counselor, someone with lived experience of mental health. We also have support groups for those who live with mental health conditions. We have classes that help them with their recovery plans. And then for families, we have family support groups, both online and in person. We have classes for family members as well, and we offer direct family support to those who need it.
Good, thank you. Pillars. What resources and services does Pillars Community Health provide? How do you work with the caregiver of adults with mental illness within your community support programs?
One of the challenges experienced by the caregivers is following up outside of the services. The service providers are only there a few hours a week, so a lot of the work needs to happen outside of that time to really see progress, and that can be difficult to follow through with on top of all their other responsibilities. However, we're always available for additional support, so it's not just during the times that we are with the client, but in between as well. It can be difficult for the caregivers to effectively communicate to others on what their struggles are and needs and challenges. There's a stigma with mental health issues, and they may be feared that they are being judged by others. We help them with these challenges. We help educate them on how to speak with their friends and family and overcome some of the challenges they might have.
Good, thank you. And the final question for this segment is going to Aging Care Connection. What do you find are the most common challenges that caregivers face when caring for an older adult with cognitive or physical, or in many cases both? And what programs, resources, and supports does the Aging Care Connection offer to caregivers of older adults with these types of challenges?
Okay, thanks, Joe. So first of all, I just want to preface this by saying that I'm filling in today for my very esteemed colleague, Jessica Haynes, who's a phenomenal caregiver support specialist over at Aging Care Connections. She couldn't be here today due to a last-minute unforeseen circumstance. So I talked with her a couple of days ago, took some notes, and I'm going to share her reflections and observations on things that she's seeing when she's working with her caregivers and their families. To Trina's point, one of the things that Jessica has really noticed is an issue for caregivers is the social isolation piece. So she noted to me that even pre-COVID, social isolation for caregivers of people with mobility issues and physical challenges and cognitive challenges, it was already problematic for a lot of people. It's hard to take, especially when you're an older adult caring for someone with various types of issues, it could be hard to take them out in public if there are, for example, mobility issues, incontinent issues, if cognitive impairment or some form of dementia causes the care recipient to become upset or agitated or fearful, disoriented, when they're taken out of their home environment, it makes it very hard. So pre-COVID, it was already an issue. Then with COVID, it just added another layer of difficulty because then people who maybe previously could come and visit didn't feel comfortable doing that anymore for fear of infecting them, and vice versa. So it's just been hard. The social isolation piece has been hard for people. No matter what the circumstance. We're hoping that as things start to lift and change, that this will change as well. But that's one of her most significant, I think, observations. She also noted, and I don't know if you see this as well, that a lot of the caregivers that she works with struggle with feelings of inadequacy or self-doubt around their caregiving skills. So they may be asking themselves, am I doing a good job? Am I doing this right? Am I providing appropriate care to my loved one? Some of them don't feel like they have the resources, be those internal resources, concrete resources to give their loved one what they need. Some of them feel like they lack the knowledge, the skill set, the education around caregiving. Some of them lack the supplies and just basic equipment, which makes things difficult. So those are some other things that she noticed. I just want to share quickly something that I noticed at the hospital. I'm not a caregiver support specialist, but I do work with a lot of adult children of older adults who are in the hospital for various illnesses. And what I notice is that they tend to, often have children of their own, jobs. They're trying to be good children to their parents. They're trying to be good parents to their children. They're trying to be good employees in the workplace, and they're spreading themselves very thin. and they're exhausted and overwhelmed and oftentimes frustrated and sometimes a little bit resentful and sometimes even a little bit angry. And then all of those feelings can create intense feelings of guilt. So guilt around feeling what they're feeling, which is really kind of normal, actually, to feel that way, but feeling guilty about that, and then feeling guilty about not being able to give enough of themselves to anyone because they're stretched so thin. So that's just kind of what I'm noting. Again, all normal feelings, but sometimes you feel kind of alone in that. So the good news is for the clients that we serve, Aging Care Connections does offer a lot of great programming through the Caregiver Support Program. And I'm just kind of going to run through our flyer and just read these off so that I don't leave anything out. But the interesting thing, as I was reading this over too, that I didn't think about is that Aging Care Connections can offer supports to people in different kinds of caregiving situations and different roles. So it's not really just older adults. It's really linking older adults, caregivers of older adults, grandparents and other relatives raising children, and family members caring for an adult with a disability with services to support them. So just a variety of different kinds of situations. So in a nutshell, and I'll try to be brief, we also offer support groups. We offer multiple kinds of support groups offered throughout the month. Right now, everything is still virtual, but Jessica told me that we should be going back in person, hopefully pretty soon, with the virtual option for people who just don't feel comfortable going back to the in-person model. We offer training and education. So Jessica told me that everything offered in terms of their training and education programs are evidence-based. They help teach and coach people around disease. So for example, in the case of dementia, to help familiarize people with that and have a greater understanding, but also they do some training around stress management, coping skills, again, offered at various times throughout the year, right now virtual, hopefully in person soon, and you can check out our website for information on those. We also offer respite, like some other organizations that spoke here today. It's temporary relief through the use of adult day services, in-home care assistance, and facility stays. So, for example, if a caregiver wanted to go to a wedding and didn't know what to do for their loved one could actually, through respite, which is free, stay in a skilled nursing facility for the weekend so that the caregiver could get away, could go out of town to attend the wedding. We have gap funding, so we have limited funds to help caregivers purchase necessary items such as medication, equipment, medical supplies. Jessica told me that they can even help pay for some home modification projects. So recently they just helped put a ramp in for someone who needed it. They've paid for dental care. They can get pretty creative, she said, which is good. We have memory cafes, which used to be done in person, really fun. They used to meet and do like some sort of interesting, fun activity with lunch. Right now it's virtual. But it allows for the caregiver and the care recipient to actually just do something fun together. Whereas sometimes caregiving can feel like you're just always working around different tasks and whatever. This is just meant to be like a fun form of socialization for both parties. And finally, our caregiver support specialists, we currently have 2, we have a third one coming on board soon, can offer one-on-one supportive counseling and also just some problem solving and assistance with decision making around caregiving, which can be helpful just to have that added level of support. So these are just a few of the programs that we offer. I know I ran long, but we just want to acknowledge that caregiving can be really rewarding in a lot of ways, but it's also really, really hard work.
Yeah. Mm-hmm. And I appreciate this information. The agencies are doing some wonderful stuff in Riverside Township, and probably the most important thing is getting the word out there. So I'd like to thank our representatives from NAMI, Pillars, and Aging Care Connection on this segment, looking at adults living with mental illness or cognitive issues and what can be done. So thank you. Welcome back. Again, I'm Dr. Joe Troiani, and Now, in this segment, we're going to look at caring for adults who are experiencing substance abuse issues. And we're talking about alcohol, alcoholism, substance use and abuse, and we'll also be talking some of the other addictions, such as a gambling addiction. On that note, we have representatives from two agencies, Pillars and Way Back In, and I'd like to take the opportunity for our speakers to introduce who they are, what do they do with the agency, and maybe a little bit about the agency.
My name is Jess Warchol. I'm the Director of Community-Based Services at Pillars Community Health. I help run all the programs that are provided in a community-based setting.
My name is Chris Ward. I'm with the Way Back In. I do grant writing and coordinating outreach initiatives, and we are a primarily long-term residential treatment center for both substance use and gambling disorders.
And I'm Anita Pindiur. I'm the Executive Director of the Way Back In, and I also serve as a Clinical Director, so I oversee all of the clinical services that we provide.
Good. Welcome again. Our first question, can you share with our viewers what supports you would suggest for a caregiver or a parent whose loved one is experiencing gambling or substance use? And we're going to ask both Pillars and Way Back In to weigh in on that.
Sure. So when working with caregivers of someone struggling with substance use, we try to provide support to the caregiver by reminding them to take care of themselves as well. Like so many of the other agencies have said, it's important to take care of yourself. You can't pour from an empty glass. You have to make time to take care of yourself. Don't neglect your feel-good hobbies and activities. Baking, going for walks, spending time with friends, whatever brings you joy. They need to remember that their wants and needs matter as well. We also do try to provide support by helping them access resources and services that might be outside of what our agency can provide. That can be done through our Family Resource Developer program or our Community Support program. That way they're not left to navigate a complicated system all on their own. We try to encourage caretakers not to take behaviors associated with their family member's addiction or mental illness personally. Instead, focus on setting boundaries, keeping communication clear, open, and consistent. Be mindful of tone and word choice when addressing behaviors, and also be careful not to display judgment. And these are things that we can provide coaching and modeling for in our community support programs to help them learn how those interactions might look and how to do that.
Good. And same question, let me turn it over to Way Back In.
Sure. So in addition to all of the supports that Jessica just made concerning self-care and support in finding treatment, I would just like to add the healing component of finding a peer support network to work in conjunction with therapeutic services. When someone's struggling with substance use or gambling, they often isolate and go off on their own, sometimes closing off entirely from their friends, their family, their support networks. And the family members themselves, as a result, can also feel closed off and isolated. They're not sure how to help their loved one. They're not sure what resources are available for themselves. So while the individual who's struggling with a substance use or gambling disorder has the option to enter into treatment programs, which could be 28-day programs, outpatient programs, recovery homes, what does the family do? In addition to individual and group therapy, which we will touch upon a little bit later, there are some other options for families to get connected to people who are experiencing something similar. Addiction affects everyone and everything around it. Family members have to recover from the effects of addiction just as much as their loved one who's recovering. There are many different support groups family members can attend to build that recovery support network. One example is Families Anonymous. It's a gathering of parents, grandparents, spouses, friends, and others with a current, suspected, or former struggle with substances or gambling. Families Anonymous meetings help people to share their experiences, strength, and hope with one another to help process the difficult emotions of having or having had a loved one who is struggling. And while Families Anonymous is a support group that covers any and all substances or negative behavioral patterns like gambling, there are also support groups for loved ones that focus on a specific substance or negative behavioral pattern. For example, there's Al-Anon for people who are battling, or for family members with a loved one battling or recovering from alcohol use disorder. There's Nar-Anon for narcotics recovery, Gam-Anon for gambling recovery. Very often, people want to meet with others who are experiencing something similar to their situation. So depending on the addiction that's affecting a specific family, these groups are designed to offer structured support that speaks to that specific substance. One of the reasons these groups are so successful is that they are easily accessible to everyone in the community. They're free, you don't need insurance, they're available in person and on Zoom. They occur at all times during the day and night, and information that you share is kept private amongst members. I'll end with, sometimes it just helps to know that what you're going through isn't isolated and that you aren't alone and that help is available. Your loved one isn't the only one who can live in recovery. And connecting with others and building that support network helps family members feel that they are an integral part to their loved one's recovery as well.
Good, good. Our next question is for Way Back In. What services does a Way Back In offer to caregivers and family members for those struggling with substance or gambling issues?
So the Way Back In helps individuals and their families in the Riverside Township community recover from substances and gambling with long-term residential and outpatient treatment services, during which people transform their lives from a renewed foundation of recovery. Those who participate in our program rebuild their lives, beginning to feel confident and grateful, ready to flourish in all of the goals that they have set for themselves. Caregivers and family members have the opportunity to go into our family program, which is dedicated to helping heal the entire family unit from the devastation and havoc that addiction has caused. Joining a therapeutic group with psychoeducation and process-oriented therapy helps families understand and navigate how a substance use or gambling disorder has affected the entire family system. Helping families heal also contributes to the success rate of the individual who's in treatment themselves on their road to sustained sobriety. Such a group helps parents and brothers, sisters, and friends come together to understand what's happening when someone is addicted, to understand that what they're dealing with is a disease of someone's mind. It's of their very thinking. And it takes time to heal those thought patterns and behaviors. Our family program really emphasizes the disease model of addiction. We help to destigmatize addiction and promote recovery for the entire supportive and family unit. And we work to help create, implement, and maintain those healthy boundaries that Jessica was talking about so that these vital healing relationships can continue in a positive manner in people's lives. Lastly, I'll end. I remember you talking about childcare a little bit earlier for some of these services that people may need, and one of the very special aspects of our program is that we do offer childcare for parents and loved ones so that they don't have to have that barrier of finding that resource to watch their children as they attend our therapy groups.
My next question, before I start, I just wanted to share some of the information that the Riverside Township Mental Health Board has been reviewing at our monthly meetings. The board has reviewed a number of articles, especially in the last 2 years, that number one, talked about alcohol consumption in the United States has gone up by 1/3, as reported by the Wall Street Journal. Since alcohol is taxed, we know every drop that's being produced and consumed. But a 1/3 increase in the last 2 years because of COVID of alcohol consumption. We've also been hearing on the news, of course, the problem with marijuana. Marijuana sales are through the roof, and in fact, it was in the fall they were talking about a shortage of product for the recreational marijuana stores. At the same time, we've also seen articles on online gambling increasing during the COVID, and as a result, we're seeing, of course, gambling addictions increase in numbers. And these are various governmental, non-governmental agencies, newspapers that are reporting this. And that's not even touching upon the horrific problem of opiate use. And in fact, the fatality rates have gone up significantly. And it's kind of shocking when you take a look at the figures over the past couple of years. And again, the board looks and examines these figures, and in discussion with our community partners, we take a look at what can we do as a board and as a community in partnership. Which brings us to our question. What are some of the warning signs and indicators that a person could look out for if a loved one is potentially abusing alcohol and or drugs, or have gotten into a gambling addiction?
Well, there are some physical signs to watch for that might indicate a substance use disorder. Those would include changes in mood like irritability or depression, sleep disturbances, abrupt weight changes, poor physical coordination. Also, of course, looking at the eyes. If their pupils are dilated or constricted, their eyes are red or glazed over, that might indicate a substance use disorder.
And then we look at behavioral changes. And behavioral changes are often changes in mood. We have to kind of remember that many of these have to be abrupt changes and really kind of outside of the character of the person. So if somebody just has a character that is a little bit more on the depressed side or a little bit more on the happy side, what changes are you seeing? What is happening? And then there's often loss, right? So they're losing prescriptions, they're losing credit cards. There's always a question of money not being where it should be. Perhaps, depending on who it is that the caregivers, but perhaps the spouse took out some money out of the bank and now it's unaccounted for. We've seen with our clients very often that we can't account for certain medications. And when we call the pharmacy will say, oh, it was filled 3 days ago and now they can't find it. And now there's more of a story. So why is there more of a story? So anything that really sounding a little suspicious and a little bit off. Nodding off is a big one, especially when we're talking about either alcohol or opiate use disorders, and then depending on kind of where those opiates are. But we also have to remember maybe any kind of really shifts in that, because cocaine has been making a comeback, and some of the amphetamines have been making a comeback. So we want to make sure that, if you see your loved one not sleeping for 3 days, or they have this extreme amount of energy all of a sudden, like where is that coming from? And with marijuana or THC and some of that being legal and being used for many recreational purposes, is there a shift in that mood? Is there more vigilance, hyperactivity? Is there more paranoia? Are you seeing any kind of signs of anxiety? I know very often it is used to treat anxiety, but are you seeing any kind of symptoms of anxiety? So what's going on? Obviously excessive sleeping, so that's, and that could be from a number of things, up to and including, and that's a very important one, gambling. When there's gambling going on, either online, because that's what was happening a lot during the pandemic, or in the casinos, often people will neglect to sleep so they can continue playing for longer and staying in these establishments for longer. And therefore, they either crash when they come back, or you are seeing kind of that lack, and that what goes with kind of those effects of not sleeping enough. Any kind of memory loss, confusion, and forgetfulness when it's not a sign of memory issues. So when there's not a history of memory loss, then what is going on? Seeing if prescriptions can be filled by more than 2 doctors, so kind of doctor shopping, as we call it, and going to different ones. I know that there are some preventions that the state has put in with that. There's websites now and doctors can check, but when you're getting maybe a phone call from either the insurance company or the pharmacy, and there's a lot of questions about why the same scripts or similar scripts are being filled, or going to doctors for medical conditions that might not be relevant, asking a pharmacist questions or asking a dentist to prescribe certain things that are off label. Preferring to be alone. And so, sometimes when you have a loved one, start kind of seeing, it's not that it's their personality. And I think that was really difficult now during COVID. We preferred people to be alone. We told people to isolate. We told everybody not to gather, right? So what is going on? When there is something going on, when there is something safe, is it that they're avoiding even Zoom meetings? Is it that they're making up excuses? There's always a headache, there's always a cough. What is going on? Lying about really simple stuff, stuff that you really don't need to lie about, right? You ask them, where did you go? And they say they went to Burger King, but they really went to McDonald's, and there's really no reason for those kind of lies. So kind of just being cautious with that. The smell of alcohol, obviously when there's alcohol use, an excessive smell of alcohol, and kind of at maybe odd hours, right? It's early in the morning, and you're just getting up for work. But also other medications and other scripts will have kind of that smell. With gambling, that's the tough one. We can't test for it. We can't see anything. So really money is that drug, and really kind of focusing, is there something missing? Is there stuff that, new credit cards are coming in, money's missing out of the bank account? And then a messy appearance and a messy house. Usually people stop taking care of themselves. And again, COVID was not a great great indicator of that, just because we were so left to our own devices. Many of us were working from home. You didn't really need to be around other people. But when it becomes very unusual, when it's different than it used to be, that's when you want to pay attention to that.
Good. Our final question to Pillars. If somebody is watching this program today and they're caring for a loved one who may be seeking help for their mental health or substance use issues, what are the services that are available, and what can the caregiver do to facilitate that?
Sure. Well, to answer your second question first, to facilitate that, they would just need to call our access and referral line, which is 708 Pillars. You'll talk to a specialist there who will help kind of ask you questions about what you're dealing with and help direct you to the most appropriate program. We have, of course, the general outpatient behavioral health program, which includes things like individual therapy, family therapy, and our community support programs. But aside from that, we also have programming specific for substance use disorders. And those include biopsychosocial assessments to help determine the level of care needed for that individual, early intervention services for at-risk individuals, outpatient treatment that is specific for substance use, also intensive outpatient treatment and individual treatment. We also offer specialized services, which include a co-occurring disorder group, which is for people who are struggling with mental health issues as well as a substance use disorder, co-occurring. A 10-hour DUI risk education class, which is available in both English and Spanish. We also do DUI evaluations and updates, also available in English and Spanish. And we have a level 1 outpatient group that is available in English and Spanish as well.
Good, thank you. That concludes our segment in caring for adults experiencing substance use issues. And I'd like to thank our representatives from way back in and our representative from Pillars. Again, thank you. The next segment, I'm going to go ahead and take a moment to introduce that segment. And it is our community partners who are part of the Community Resource Center. It's something that has been done in partnership with the Riverside Township, a mental health board. We launched it a couple of years ago, and they do some exciting things, and it's a valuable service to those members of the Riverside Township community. So thank you, and our next segment will be those representatives.
With everything that's going on in the world right now, sometimes it can feel like our lives have been turned upside down. Many of us are dealing with health-related fears, job loss, financial difficulties, and social isolation. These can bring on feelings of loneliness, worry, anxiety, and depression, and can strain our capacity to cope in ways that are successful and healthy.
If you need guidance in accessing services and supports in the community, or even just need somebody to talk to, please reach out. We are the Riverside Township Community Resource Center, and we are here to help. Call 708-853-9578 to speak with a community resource specialist who can connect you to services related to aging, benefits counseling, intellectual and developmental disability services, mental health, substance abuse, housing, and more.
We are located at Riverside Town Hall at 27 Riverside Road in Riverside. We are open Mondays, Wednesdays, and Thursdays from 9 a.m. to 11 a.m. and from 4 p.m. to 6 p.m. We are also available on Saturdays from 9 a.m. to 1 p.m. We look forward to talking with you and helping you assess the resources and supports that you need. The Riverside Community Resource Center is a service of the Riverside Township Mental Health Board, and we are proud to be making a difference in our community.
Hi, my name is Susan Bertuglia. As mentioned previously in the program, I'm a social worker at Aging Care Connections, and I'm here with my beloved and esteemed colleagues, Chris Ward from Way Back In and Amber Grzeda from UCP Seguin, because we are the three individuals who staff the Riverside Township Community Resource Center on a part-time basis throughout the week and on Saturdays. So we are located right here in Riverside Town Hall at 27 Riverside Road in Riverside. And our role is to connect members of the community with whatever supports or resources that they might need. So in addition to the programs and the resources that we discussed today during our panel discussion, The CRC can assist with connecting residents to a variety of other types of resources, and I'll just read off a few that we've connected people to during our work here at the CRC. So we've connected people to aging services, to benefits counseling, intellectual and developmental disability services, mental health services, programs for individuals with substance use issues, housing and rental assistance, transportation assistance, and we also offer some supportive counseling for people who might just need someone to talk to or someone to listen. So we want to encourage folks to reach out if they have a need. You can contact us by phone at 708-853-9578 or by email at crc@riversidetownship.org.
And as Susan said, we are also available in person Mondays, Wednesdays, and Thursdays from 9 a.m. to 11 a.m. and again from 4 p.m. to 6 p.m. We're also available Saturdays from 9 a.m. to 1 p.m. And lastly, I just want to say that the Community Resource Center is a service of the Riverside Township Mental Health Board, and we're just very proud to be making a difference in our community.
And I want to say thank you for tuning in and watching our presentation on caregiving. Regardless of your personal situation, all caregivers can benefit from some honest self-reflection in incorporating a balance into their day. If you are a caregiver, your instinct might be to put your head down and just muster through those caregiving duties. However, ignoring your physical and mental needs will only cause you more problems in the long run. Remember, you are important. Make a renewed commitment to yourself and your loved ones today by seeking out some of the support programs that we learned about. We thank you again for watching.